if opportunities are presented to you to like feel something else out or investigate something else, do those things. Don't just like shoehorn yourself into the one thing that you think. Because I mean, in general, like who we are at 18 is not who we are when we're adults, thank God,
Yeah,
in
that's
most
right.
cases.
But yet at
And so you
18,
should.
we're expected to decide what we want to be when we grow up. Hello, everyone, and welcome to the Patient to Professional podcast. My name is Dr. Nick Despotidis, and I've had the privilege of examining thousands and thousands of children over the years who are now adults in all different careers. Today, I have the pleasure of having one of my long-term patients, Dr. Rachel Walter, as my guest. Dr. Walter is a veterinarian who specializes in surgery. I couldn't wait to have her on. So, Rachel, thank you so much for joining the podcast today.
Yeah, thank you so much for having me. I'm really excited to be here.
So, Rachel, I've known you a long time. I looked at your
Mm-hmm.
record. I think you were my patient when you were 10 years old. And I've watched your career through high school and college and vet school and then doing a fellowship. So, I want you to start sharing with the audience a little bit about yourself today. Where are you? What does your typical day look like?
Yeah, absolutely. So I'm currently practicing at a VCA, which is a corporate hospital at the Jersey Shore. I've been there for about 3 years now. And prior to that, I was working up north in Hoboken. I did my undergraduate at Rutgers University and then moved on to Western University out in California for my medical degree. And then, like I said, currently, I've been working at my practice for 3 years. And so an average day can really look quite different depending on what's going on. I have days where I see appointments, and that can vary from preventative care like vaccines and discussion about just overall wellness, maintaining our wellness in our patients, to sick cases, managing things like cancer, chronic disease,
Wow.
that kind of thing, as well as just any emergency that walks in the door. And then there are other days where I'm performing acupuncture. That's actually something I was recently certified in, that I've really been enjoying. And then obviously days where we're in surgery all day. So like, again, the average day is not super average in our field,
So,
which is really great.
I want to ask you a question. A lot of people get into veterinary medicine because they don't like dealing with people.
Yeah.
They like dealing
Mhm.
with uh, animals, all sorts of animals.
Correct.
But I've found from speaking to you and other veterinarians who are my patient, you have to deal with people. So why don't we start there? Let's
Yeah.
start with your clinical day when you're just doing general veterinary medicine.
Mhm.
Do you do wellness checks?
We do. Yep. So again, a typical like appointment day where I'm not in procedures doing surgery. We have scheduled appointments, but typically if someone walks in with an emergency, we're going to see that as well, just because that is our duty and our obligation to that patient. But a typical day can vary from appointments, again, talking about a new puppy and discussing all the things that go into having basically a baby in the house and what
Sure.
that care entails and what the next, few months to years of their life are going to look like. Then, the opposite side of that is obviously the end of life conversations, discussing quality of life and, when and if it's time to, make the decision to humanely euthanize, which is a unique conversation in my field. Not something that is, I think, as kind of like precisely discussed, in our human counterparts. So that's kind of a unique thing that I think a lot of people have a misconception about. It's actually kind of strangely one of the more important parts of my job, the part of my job I'm more passionate about. But again, then we see kind of everything in between, patients that have chronic illnesses like endocrinopathies or chronic or orthopedic issues, and just managing those things, and kind of coming up with a game plan with the owner. And that's really the thing. I've heard that so many times in new students that they want to go into medicine, but they don't like people. And so they want to go into
Right.
veterinary medicine. And I think a really, really, really important thing for anyone to remember that's entering this field and realistically any field is that there's always a human element. These animals always come attached to an owner at the opposite end of the leash. Even if you go into something like lab animal medicine, right, where there's not really a human owner, there's still research heads that are responsible for these animals and that have, a vested interest in the care and outcome of these projects. So even when you're, eliminating the general public, let's say, from the equation, there's always a human element. And, I think one of the things that drew me to this field, and I think is what draws a lot of people to the field, is, not just the animals themselves, but the human animal bond. And that's something that I feel really honored to get to participate in the preservation of, and really just enjoy witnessing every single day. It's not just the animals, but their value to us, and just again, the relationship that everyone has with their own animal in their own way.
There's a lot to unpack there. So
Yeah.
the first thing I want to unpack, because I've been a dog owner all my adult life. And unfortunately, in that time, I've had to put away a lot of, you could see I get emotional just thinking about
Yeah.
it.
Yeah.
And it was the way the veterinarian communicated with me, because the guilt is overwhelming.
Of course.
I'm sure they
Yeah.
always ask you, when is the
Yeah.
right time?
Yep.
Will they tell me? And then when that day comes, it's so vitally important that the veterinarian and I do this as gently as I feel we need to. So could you expand on that, how you really need to understand the owner, the human being behind the animal, if you will?
Yeah, absolutely. And so that's why I think, one of the beautiful parts about, working in a practice where I have regular clients that, some of these animals I see over the span of their entire lives. And
Wow.
obviously in that time, I build a pretty deep relationship with the owner as well. And so I think being really cognizant of that bond, and again, not just the person, not just the animal, but the unit of both of them,
Right.
is really, really important when it comes to those end of life discussions. Because, I have some clients that they will do anything under the sun, spend any amount of money, any amount of time. They'll fly to Japan if they have to do X, Y, and Z.
Wow.
And then I have other clients that, they themselves don't think that that's necessary or correct, and they don't feel that that's right for their animal. And there is no right or wrong.
That's right.
All of my job is to shepherd, my clients to what the best decision is for both them and their animal. And that looks different for every set of clients and patients that comes in. And so I think, just being really hyper aware of the fact that when we're talking about the hard conversations, again, end of life, euthanasia, that kind of thing, is that there's more than just the animal at stake. I
Right.
oftentimes ask not just about the quality of life of the animal currently, but what is the quality of life of all of the
Wow.
members of the family? Is the animal's condition affecting you as a caretaker? Are you experiencing caretaker fatigue? Are
Right.
you stretched thin because you have a house full of kids and an old dog with mobility issues, and you simply don't have either, the physical ability or the time to devote to appropriate care? That changes things, whereas, an owner that has no other responsibilities, works from home all the time in the world, that end of life discussion is going to be different because of
Right.
circumstance. And again, there's no good owner or bad owner. It's just we
Right.
have to take, what we have in front of us. So I think, again, being really aware of that human element in this job is important to not only provide good care to our patients, but also to our clients, who are
Yeah,
also
it
our
sounds like
responsibility.
you're almost like a psychologist, because you have to really analyze the dynamic, the family dynamic,
Yeah.
and the relationship the owner has
Yep.
with their animal.
Yeah,
Because you're
absolutely.
right, it affects me as much as the animal at any step of care.
Yep.
So let's go to a different day. Let's do your surgery day. Now, we'll talk about your training, but when you have a surgery day, is that all day you're doing surgery?
Yeah, so I have a dedicated surgery day. There is a weird one-off where we'll do, like, if there's something quick that needs to be done or somewhat emergent, that'll get, kind of moved into an appointment day, and things get jostled around very
Sure.
hectically. But yes, typically my surgeries are scheduled. That is my dedicated surgery day, which I quite like, because I think I have a little bit of a different headspace when I do surgery
Right.
versus when I'm in appointments all day. Just like, a little bit of a different, like, MO that day, I guess. So
Sure.
I like that because it provides me focus. I can really just focus on the patients I have in front of me, and the procedure at hand. And those days I actually quite enjoy, because it is a nice break a little bit. I like having
Yeah.
that, again, like a different, total different routine, different orientation
Right.
of the whole day, midweek, to kind of break up the appointments. It's just a nice little change.
Let's talk about a few surgeries. See if
Yeah.
some of the patients are interested. What's
Mm.
typical surgery that you do almost every week, and what's atypical?
So I would say typical is a lot of, our preventive care surgeries. So spaying and neutering of younger pets or older pets, whatever the case may be. I do a lot of mass excisions, so removing of benign or cancerous masses and obtaining a biopsy for those. That's, I would say, probably the number two most common procedure I do behind the spays and neuters. But we do other kinds of surgeries that, I pretty much will do anything that I feel we have the equipment and manpower to pull off. Obviously, that I feel is appropriate for that patient at the time. But we've done things like cystotomies, going into the bladder and removing bladder stones from dogs that are obstructed or cats that are obstructed. I've done gastropexies, which is a prophylactic surgery where the stomach is actually tacked to the abdominal wall in large breed dogs that are prone to something called gastric dilation of volvulus, where the stomach actually twists and it can become an emergency situation very, very
Right.
rapidly. I've done enterotomies where a cat eats something weird and we have to go in and pull it out because it's stuck in the intestines. Really anything that I think is, reasonably within our scope, we'll do. One of the beautiful things too is we do have, I will say, as a veterinarian in the Jersey Shore area, that's a little unique to a lot of the other places out in the Midwest or even down south, is that we have a plethora of tertiary care facilities, within a stone's throw. And so, in a lot of situations where this is a really, really critical patient that's not stable, I think this is something that's going to need multiple days in the hospital, overnight care, that kind of thing. I do luckily have the option to refer those patients to a tertiary care facility. But for the people that either cannot do that financially or just are more comfortable because they already have the rapport with me as a doctor, I'll really do anything that I think is within the realm of good patient care in
Okay.
our
So
hospital.
something specialized like ocular, you may have to refer them to an ophthalmologist and a
Yeah,
veterinary
so like
ophthalmologist.
I don't do phaco or anything like
Right.
that. I'll
Right.
do if they have like an eyelid mass or something like that, that's something I'm comfortable with. But
Okay.
typically anything like intraocular, I'll remove an eyeball, but
Right.
anything like within the lens or anything like that, we do actually have veterinary ophthalmologists who, have special equipment and are more trained to handle those kind of
How
cases.
about orthopedic?
Orthopedic, so there are surgeries that we could potentially do at our hospital. I gotta be honest with you, I'm a soft tissue girl.
Okay.
I really prefer soft tissue surgery, so I do not typically do a whole lot of orthopedic
Mm,
surgery. A lot of those procedures too, they're bone cutting procedures that require
sure.
special plates. And so really, the people that are over at those tertiary care facilities, they have all of that stuff. And so typically those cases I do send, to the orthopedic
So a hip
specialist.
replacement, knee
Hip
replacement, if your
replacement,
patient can afford it, if
exactly.
they'll go there. How about oncology? If you have to remove a mass, is that something you do?
Yep, absolutely. Like you said, I would say that's probably the number two behind the prophylactic, kind of spays and neuters. Mass removals are a really common thing that we do. And we do the full preoperative workup, much like what would happen if you were a human being undergoing the same thing. I can either, perform an ultrasound and then chest x-rays or send you for a full body CT to make sure that everything looks clear. And then,
Okay.
we can certainly perform the surgery if it looks safe to go forward with.
And as I recall, we're going to start going backwards a little bit.
Hmm.
You liked surgery. You were in veterinary school, correct? And we're
Yes,
going to go
yep.
slowly backwards. Did you have a fellowship that you did to become a
So
surgeon?
I did not have a fellowship.
Okay.
I am not a boarded surgeon. I'm just a general practitioner that quite enjoys surgery,
Okay.
which is one thing that I think is really great about veterinary medicine too. That I think is something to highlight, is that really like there are no closed doors in this field. Even as somebody who does not have is not a boarded surgeon, anything that again I feel is within my
Sure.
scope and that my team can handle, I can do. There's only a few things that are really only supposed to be performed with those specialists 100% of the
Right.
time. And so that gives you a huge amount of flexibility to explore in this field. If you're the kind of practitioner that you hate surgery and it's not your thing, you can really limit your surgery to the spays, neuters, really basic stuff, and
Right.
then refer out. If you're a general practitioner who loves surgery and you want to do again like more advanced procedures, emergency procedures, there's not really a ceiling there. Like, really
Right.
it is just a matter of what materials you have and the skill level of your technicians and things like that. But that's, I think, one thing that's really great about this field in particular is that, you can kind of do whatever you feel comfortable doing,
Yep.
and seek training, in any context, regardless of, as long as you have that veterinary degree, then, there's a lot of open doors after that,
That
which
is
is,
really true because I know with my vet, I want him to do as much as he feels he can do
yep,
because I feel comfortable with him. When he
exactly.
has referred us to the hospital, I know I'm in trouble
Yeah,
because he knows the prognosis is very uh, low at that point or
yep,
beyond his skill set. So that's
right.
interesting. Before we move on to your veterinary education,
Hmm.
what different fields within veterinary medicine? I actually have a patient who is now a veterinarian. She does
Hmm.
physical therapy and
Yeah,
rehab
very
for
cool.
patients post-surgically,
Yep.
post-trauma. And you mentioned lab work. So let's say I am a vet, but you know what? I just I don't like dealing with patients. Tell me a
Hmm.
little bit about some other fields for people that still want to be a veterinarian, but don't have maybe the people skills that are needed that you're
Sure.
referring to.
So yeah, I mean, again, I think that was a really, really consistent bit of advice that I was given when I was, kind of growing up and coming into this field. I think if you recall, like my gateway drug into veterinary medicine was horses.
Yes,
And
I
so
remember that.
yep, and if you had asked me when I was like 17, 18, I would have told you that I was going to be a boarded equine orthopedic surgeon, period, bar none. I over time really changed, kind of my view on what I wanted. And, now the idea of that, like that is not what I wanted to do, turns out. And
Right.
so I think keeping an open mind and realizing that there's so many things to do with this degree, not just going out and working in a hospital setting or an ambulatory setting. I have friends that went to veterinary school, graduated, and got a job in a general practice. They were out for 6 months to a year, and they were like, I hate this. I don't like this. It's not fulfilling me. It's not bringing me the joy I thought it would. And so they are working either, I have one friend who's now working as a consultant for a company that works in actually fecal transplant science, which is really,
Wow.
really
Doing
interesting.
research.
Research and talking to other practitioners about, what this product is and helping design specific treatment plans for patients, with this science, this modality at the core of it. And then I have another friend who she's actually gone back into academia. And so, there's a lot of opportunities outside of just when you close your eyes and you imagine what a veterinarian is. You could work for, a food company and work as a rep. You could work for a university and help, bring up the next generation of practitioners. You could, completely change gears, even something like I said, earlier, I've done, which I think this is a really important thing to help just mitigate burnout is, always reinvest in yourself. If you're feeling a little tired or like you're stuck in a loop, reinvest in your learning. Being a learner is likely what's drawing people to these fields in the first place and loving learning. And
Mhm.
so when you feel that burnout or when you feel a little uncertain, take a step back and reinvest in your own education. And so one thing that again, if you had told me when I was like 18, 19 that I would be doing acupuncture, I probably would have rolled my eyes at you at that time.
Right.
But it's actually something that I've become really passionate about, and never in a million years would I have thought that that's something I would be doing every day.
Right.
And it's another thing that I have, God forbid I ever decided that I really wanted to take a step back altogether from general practice. I could go, and just be an acupuncturist, and work for people in their homes or at, these tertiary care facilities where they have patients recovering from major, spinal or orthopedic surgery.
Right.
And that would totally look different than what I'm doing right now.
Right now. It's interesting you said that because when I got into optometry school, like you
Hmm.
had a set picture of
Yep.
where I'd end up, and it's nowhere near where I ended up
Yeah.
today. I
Yeah.
never thought I'd be fitting hard contact lenses in children to slow down
Right.
myopia. I had a very medical model. I was treating disease. I was treating all these things. And over the 4 or 5 years after that, like you said, my thought process evolved. Sometimes you
Yep.
meet doctors, optometrists, veterinarians in your case that you say, oh, okay, I like the way he or she is handling
Right.
themselves or practicing. So that was very, very helpful for students to at least understand, even when you choose a profession, there's many options within the profession, and you're
Yes.
not glued, you're not tied to your initial choice.
Yeah, and I would say if anything, like really, I mean, even though if you feel really, really positive that's what you want to do, don't marry yourself to that
That's
idea. You
right.
know, if opportunities are presented to you to like feel something else out or investigate something else, do those things. Don't, don't just like shoehorn yourself into the one thing that you think. Because I mean, in general, like who we are at 18 is not who we are when we're adults, thank God,
Yeah,
in
that's
most
right.
cases.
But yet at
And so you
18,
should
we're expected to decide what we want to be when we grow up.
to
And,
decide
and that's
everything.
what this podcast
Yeah,
is about. I mean, how
absolutely.
do you know? And even when you think you know,
Right.
you
Right.
you just don't want to, like you said, horseshoe yourself into that decision. And that's what's happening
Absolutely.
sometimes. Sometimes the students abbreviate their, let's say, medical training from
Yep.
8 years to 7 years, sometimes six, and they don't realize that you're going to do that for the rest of your life.
Right. Right.
So let's talk about veterinary school. Where
Mhm.
did you go to school? You said out west. Let's just talk about veterinary school, and then we'll go into how you got into that school, why you
Yeah.
chose that school.
Yeah. So I attended Western University out in Los Angeles County in California. I was out there for 4 years. I really, really liked my experience there. It is definitely different than the kind of classical didactic system, the way they teach, and they use problem-based learning, which is becoming more and more common, in medical training facilities. A lot of the newer universities that are opening are at least doing like an integrated problem-based learning
Right,
model.
right,
I quite liked that because it wasn't sitting in lecture for 8 hours, just having somebody, spill out whatever notes you're supposed to take for the day. It is very self-guided. So me as somebody who, again, I don't really want to sit and listen to someone lecture for 8 hours. I'd like to think critically, and that's how I learn. Like a really truly problem-based learning works very well for me. And that was the entire style of education there. So, certainly I think it was a little jarring for certain people coming from
sure,
often classic didactics and undergraduate training,
right.
to move to this where, again, class time is more limited. A lot of it is small group discussion, working through case studies. But I felt that provided great training for what this job is, which is, to think clinically, you need to think critically. And I think that was just something that was, just intrinsically part of the education there from day one.
So that's important because medicine, we're still in that didactic training. Although, like you
Yeah,
said, there's locally Hofstra Medical School is going to that problem-based learning on day one.
right.
Why don't you talk a little bit about the didactic? I went to UPenn, let's
Yeah,
say veterinary school. It's very different than the experience you got in
yeah.
California. Let's talk about typical didactic. Is it 2 years of academics and then you go into the clinic year 3 and 4?
I think typically most schools it is, 2 years of didactics and then 2 years of clinicals, which my school was also, 2 years
Sure.
of problem-based learning with some clinical rotations mixed in there, and then 2 years of just pure clinics.
Yeah.
So, the time was similar, but I think, a big difference in the didactics is that you come into your clinics and you know all this information but you don't know how to necessarily apply it to a
Right.
case. It's all in there, you have it all banked, but the application and the ability to again like take that knowledge and critically apply it to a clinical situation, that takes practice. And I feel like, one, I think I'm fortunate in just a sense that that's a little bit how my brain likes to work naturally. But also, the first day that we sat down in class, at Western University, it was in a group of 10 kids, a
Wow.
facilitator, and a case that we had to work
Right.
through. And certainly the first few cases were really rough because we didn't know what we were doing. We were all
Sure.
first year vet
Sure.
students, little baby vets. But I think it surprised all of us how quickly that, we were able to look at a case that we really maybe weren't familiar with what was going on at all, but we could use those critical thinking skills that we had developed to figure out a plan and an approach and
Yeah.
an analysis of the whole situation, which I think is something that the traditional didactics don't give you as much of that, like again, like intrinsic critical
No,
thinking.
100%, even less these days. They
Yeah.
do externships. And I guess the students should learn that's listening to this neither one is right or wrong. For me,
Yeah.
I kind of like the didactic, get an A. We
Yeah.
both have to take the same boards,
Yeah,
correct?
let me tell you, I had some classmates that absolutely hated the PBL system. So
Yeah,
it's,
which is
you
what?
know,
It's the problem.
problem-based learning. Yeah,
Problem based because you still have to take your board exams. So if you're
exactly.
not a self learner, if we're a vet student that goes to a primarily didactic school
Yep.
versus problem based learning,
Yep.
we still have to pass our boards to get our
Yep. And
veterinary
they're the
degree.
same for everybody. So
Yes.
yeah.
So if you're not a self learner, you're
Yeah.
better off going to didactics where they teach you for 2 years and then they
Yes.
slowly launch you year 3 and 4.
Yeah.
With you, it sounds like day one
Yeah.
you were actively involved with patient care.
Yeah. And again, I think that's a really, sentient point there is that there is no right or
That's
wrong.
exactly right.
What worked for me really well, like I said, I had some colleagues that absolutely hated the problem-based learning system. They just, they felt like it kind of like what you're saying is that they didn't have a lot of guidance. Everyone still has to take the same boards at the end. It's a little bit less clear, I suppose, you know what I mean? The path there is a little bit more or less, it's less straight and narrow. It's a little bit foggier, a little grayer. And so, what works for one learner is not going to work for another, and there is no right or wrong. But it's good to know that there are different systems out there. And I think when people are applying to medical school, I think a lot of times they just want to get in somewhere.
That's
And
correct.
and though I do understand, that you want to get in. I think the quality of the education that you get, and also, not for anything, but location is important too. I knew for sure that I would be miserable living out in the Midwest. I knew I did not want to go to school in Iowa. I did not want to go to school in Michigan where it was going to be negative 15 degrees all winter. I just knew that wasn't going to be conducive to me being happy in school, to feeling like I made the right decision. And so I only applied to colleges that were either, on the West or East Coast.
Wow.
And I was not only excited to get into Western University, I was excited to move to California and live in Los Angeles and eventually San Diego for a few years. I think that was a huge factor in why I was successful in school, not just because, the teaching system was good for me, but also that I put myself in a place where I was really happy. I was really excited,
Yeah.
not just to be in medical school, but to move someplace that I was excited to live for a few years. I think my quality of life overall in veterinary school was a lot higher than some of the people that I talk to now because, they were, again, freezing their butts off in the winter somewhere out in the Midwest and really isolated. And I didn't really feel that way when I went to school in
Okay.
California. I had a lot of other things outside of school that, improved my balance of my education and just my overall quality of life.
But that's important. You
Yeah.
you said you went to Rutgers undergrad,
Hmm.
but you, did you take a gap year between graduating Rutgers to kind of figure this out? Because to
I
be
did.
honest with you, I just wanted to get into optometry school, and
Yeah.
I probably lucked out that I ended up in the East Coast. I would
Right.
think you left yourself a little space to find out what you wanted and prepare for the
Yeah.
didactic rigors of
Yep.
vet school. Could you talk about Rutgers and your decision to go to vet school?
Absolutely. So, I went to Rutgers. Honestly, Rutgers was, kind of a twofold decision. One, it was close to home, which I liked because my family is here. This is where I've grown up.
Sure.
And at 18, I really just wasn't ready to be, thousands of miles away from my family. So that was a huge benefit. They also have a wonderful pre-veterinary program there. I feel like the
I didn't
training that
know
I,
that.
yeah, the training I received there and the hands-on experience I got there, I think was super, super, super beneficial to me, entering the later stages of my education. So, that was another big element, but also financially, I was an
Sure.
in-state student. I knew I was going to be spending a lot of money down the road on school, as a medical student. So that was, kind of the most affordable option with my scholarships. And so I figured, stay close to home, get a good education, don't spend a lot of money on undergrad when we're planning to spend a whole lot of money
Wow.
later. But after school, I think I felt like a lot of people in my life, even people in the field of veterinary medicine were telling me, don't take a gap year. If you stop now, you're going to, start making a little bit of money doing something and you're never going to want to go back to school. Once you stop, you're not going to want to thrust yourself back into education. And, I did think about it and, kind of teetered on the decision to wait to apply to school or to just, jump right in and do it. And I ultimately decided to wait. I took a full year off. And I think That was huge because one, I was tired after college. I needed a little bit
Sure.
of time out of the classroom. I needed a little bit of time to, make a little tiny bit of income before I went and made no income, spent a lot
Right.
of money on
Sure.
student loans over the next 4 years, and just gave myself time to figure out what I wanted to do. I really feel like if I was grappling with senior year of undergraduate and applications to veterinary school, which is not a small feat. I mean, there's a lot of paperwork and essays and all sorts of things that go into applications. It's not just typing a few things in on a website and
No,
pressing enter.
no.
And so I think the fact that really my focus, my gap year, was working in the field and gaining experience, which I think made me like a really, really, really strong student when I came in, because I not only was refreshed because I had taken some time off, I also was working in the field. I was seeing things every day that were totally foreign to my classmates because they had no hands-on experience, of any
Wow.
significance. So I think that that gave me an incredible leg up compared to my classmates, just from an experience standpoint, because you can read a textbook all you want, but you never forget a case that you see, in all of
Live.
its
No
all of
doubt.
its yeah,
No
trauma
doubt.
and whatever else that you see in person. And so I think, again, I would say anyone that's thinking about, do I want to go to vet school? Is now the time? It is okay to take that time, as long as you're using that time to really sit back and make those decisions and think about what you want, and ideally use that time to further your experience,
Yep.
and
For work in the field to find out.
exactly. So I mean, even if I took an additional year, I mean, I had classmates at university out in California. I think my eldest classmate, she was graduating at 47. She had been a teacher her whole life, and just
Right.
had always had a dream of being a vet. Her kids grew up and she decided, I'm going to go back to school. And she went back to school and graduated, with a veterinary degree at 47. So it's
Oh,
never too late. I think it's a myth, the whole idea that if you take a break, you're not going to want to go back into school. I think if you want it badly enough, that extra time is not going to be a factor. If anything, it will make you better when you get there. And if
I
in that
agree.
year you decide it's not what you wanted to do, then you probably shouldn't have done it anyway. You know what I mean? You probably would have
Right.
regretted your
Better
decision to
find
go to
out.
school
Yeah.
if you just, yeah, better to take the year and decide, I'm in the field, I'm working in the hospital setting. I don't like this. This isn't for me. This isn't what I want the rest of my life to be. Better to realize that now, prior to going to school, spending a whole lot of money on student loans, spending, your young years doing something that ultimately, really wasn't for you. You just didn't realize it at the time.
100%. Very hard to do. It's easy for us to
Yeah.
say that. There's a lot of pressure,
Yes.
like, and I think your advice of at least working in that gap year is
Yeah.
vitally important instead of just sitting home and doing your application, which is daunting. Before we
Yeah.
move backwards a little bit, tell us a little bit, how difficult is it to get into veterinary school? I've heard it's more difficult than becoming an allopathic physician, actually, or
Yes.
osteopathic physician.
So it's highly competitive. You have to realize that, versus some of the, the human medicine counterparts, the availability of seats in veterinary schools is pretty limited.
Yeah.
When I was going to school, I think at the time there were only 29 accredited veterinary schools in the country. I think now it's up over 30, in the low 30s, because there's been a couple new ones that have
Right.
joined the pack. But it is not like there's a million options out there, and a lot of those schools, they have 100 seats, maybe even less, per year
Yeah.
available.
So you're talking about 3,000 seats total, if
Yeah, and
that.
I mean, the amount of people that want to go to veterinary school, we have to remember too, like, this as a field is a developing field. People these days statistically are having pets, not kids. People look at their
Yes.
animals as
Yes.
their actual children, myself included in that. And so the type of care and the level of care, the demand for that goes up and up and up. And
Yes.
so, the amount of practitioners and the training of those practitioners is also going to need to go up with
Up
that.
in it. Yes.
And so, it is highly competitive. There's, certainly situations where two identical applications come through, and, maybe something slightly different about one's interview versus the other. Basically two people who are absolutely qualified to be students, in a veterinary program, and just kind of luck of the draw. One of them is not accepted and the other one is. So it
Yeah,
is very tough. I have known people who have had to apply 3, 4 years in a row to get into school,
but they
and
do, right?
but
They
they
get in.
do. And I think, if you show, even if you don't have the strongest grades or your SAT scores are not, the best when you were applying to undergrad, and your, GPA again was not perfect coming out of college, I think two things that you can do is, one, show perseverance, continue
Yep.
to apply to the same schools, show that you really want this. They don't ignore that. They acknowledge that, hey, this person has applied 3 years in a row. They want this badly. And the other thing is just always, always build your experience. I think experience is going to be the most important thing to show, again, one, that you care about this field, two, to make you a better student once you get in, and three, just to affirm to yourself that this is what you really want, because it is a huge decision. It's going to be
Huge.
a financial decision that have to deal with for the next few decades of my
Well,
life.
let's talk about those two things. What is
Yeah.
the average GPA that a college student would need to at least apply to veterinary school?
Yeah, I mean, I think when I was applying, they, out of like a 4.0 GPA, they would recommend like a 3.4 to 3.6 and up. I would not say do not apply if you do not have that GPA. I know people who had much lower GPAs that were admitted to veterinary school, because again, your GPA is not the only thing that they
It's
care
one
about.
thing. And,
One thing.
and how about the standardized, the aptitude test? What do you take? I know in medicine we take MCAT. What do you take?
So there used to be a VCAT that they've done away with. So they just typically have you take your like normal college, exit exams. To be quite honest with you, I don't really know what numbers they look at there. I think that's pretty low on the totem pole of things. I think
Really?
your GPA is certainly important. Experience is huge. I mean, they want you to have, ideally like 1,000+ hours of experience when you apply to school, in all,
Dedication.
yes, in all different
Right.
areas of veterinary medicine.
Okay.
Somebody who's never been around animals or touched an animal, and has no experience to discuss,
Think that, yep,
they're going to need a little bit of a higher GPA probably to
got
get
it.
in.
And how about expense? You say, the loans are enormous. You don't have to
Yeah.
give me your amount, but does it
Yeah.
cost 75,000 a year, 50,000 a year for the typical?
Average. So these are, average for kids that are going to school stateside, and this number goes way up for people that are going to school in the Caribbean. I would say average, most people are coming out of a 4-year program with around 250 to, even upwards of $500,000 of student loan debt.
Wow. And
And that's not
500,000
including,
may be the Caribbean students?
I mean, that could be Caribbean students or some private universities domestically as
Really?
well.
Holy moly. So it's over
Yeah.
$100,000 a year.
Yep.
So,
Yeah.
okay.
So that's another reason why I think, if you're young and you're thinking this is something you want to do, it is a wonderful field, and it is, I can't imagine doing anything else, but it is an incredibly, like, it's a almost a number that I can't really
It's a commitment,
perceive,
right? Yes.
so I think, taking time and getting the experience, getting your feet wet in the field is really valuable, because again, it is a huge sacrifice. I mean, really truly, I spent, 8 years of my 20s in
Sure.
school. I didn't really have much flexibility with my schedule. I had no real income at the time. So, while I was watching some other people I know, they were making money and traveling and starting a family, you put all that on hold and you're racking up a huge amount of debt. So it should be something that you feel is
Passionate
worth
about.
that sacrifice. And so
That's
that's why
right.
I think, like, even if it's not a gap year or something, get a part-time job when you're in high school or in college, work a day or two a week at a clinic, and just make sure that this is something you really want.
Want.
Because it is not without sacrifice for
No doubt.
sure.
What does the average veterinarian make? I know in my profession it's about 160,000,
Yeah.
a little bit more, a little bit less. Veterinarians, where their salary range?
It definitely varies location to location. In this area, I would say average is around, 110 to 120 as a new graduate. You can definitely see numbers that are higher and lower than that,
Lower.
depending on where you're at.
Okay.
When I got out of school, I had offers at like 80,000 a year,
Sure.
which was just not going to be tenable for
But
me.
same thing with new grads here, and
Yeah.
I guess, and certainly if you're graduating with 300,000 plus,
Yeah.
that's a consideration. So
Yeah.
when you work into a clinical setting, it really depends where you are
Hmm.
geographically in the area here in the United States, but also I guess how you practice. If I'm teaching at a college, I'm assuming
Yep.
that's a lot less than if
Sure.
I'm in a clinic.
Yeah, absolutely. And obviously, with certifications and specialties, things like that, that number goes up. There are some
Yeah,
veterinary specialists that make upwards of $400,000 a year. But I also know that there are veterinarians that work, again, out in the Midwest and, like more underserved communities that are
sure.
making $65,000 a year.
Mm,
It just really depends on, again, location and what you can offer your
yeah,
clients. My
yes,
my income has definitely gone up just over time with my surgical abilities and now able to offer other things like ultrasounds and acupuncture and things like
yeah.
that.
I
Um,
remember sending you a note because your mom had mentioned what a great surgeon you have become and how much you enjoyed surgery,
yeah,
I
yeah,
guess you have to go with what area you like.
yeah,
Some doctors don't want anything to do with surgery. Some veterinarians have,
absolutely.
like you said, not even
Yeah,
just routine surgeries, and they find another path.
right. Yeah, and I
Yeah,
think that's again, you really just have to keep an open mind.
sure.
I think one of the things that uh was a good quality of mine is that I really never said no to anything. I was always
Right.
willing to try things, and I again have ended up in a very different place in my career than I would have thought rewind 15 years ago.
And it may change again. It's
And yeah,
amazing.
and
That's
that's
the
totally
beauty. You
fine.
said it. Education is the key, is
Yeah,
constantly renewing yourself if you feel a little bit stagnant or burnt out.
right, right.
So let's go back to high school now, if you can remember back then.
Yeah.
Were you thinking about veterinary medicine as a high school student, ninth, 10th, 11th grade?
Yeah, I don't know exactly when this kind of materialized into my firm plan, but definitely I would say by middle of high school, this is what I wanted to do.
To do.
And I had kind of, I've obviously always been an animal lover. My parents, my older sister was a dog. My parents have always had animals. I've always been around animals. And I always really had a passion for them. And I always really was drawn to medicine and just like being a healer. And being I like the idea of like a high pressure job. I like everyone in the room looking at me, looking to make a decision. So I've always been drawn to the energy of medicine in that way. But I wasn't really sure, was I going to go into, human medicine? Was I going to do veterinary medicine? Was I not going to do it at all and just, have animals be something that I enjoyed? I was really, I loved art when I was in high school as well. So that was
Wow.
something that I
Okay.
kind of, I dabbled in a little bit and kind of considered, is that a path I want to go down? And again, I don't really know when it all just kind of like crystallized into my plan, but probably by around mid high school,
Okay.
I had decided that this is what I wanted to do.
There was two key points you brushed over, and I want to emphasize them. You wanted people to come to you as the decision maker,
Yeah,
correct? Is that what you said?
yeah, yeah,
And you also have this passion for healing. In other words, you like when people come to you for help and you're able
yeah,
to help them.
yeah,
That's really,
absolutely.
that has carried you over, obviously, to today. You've said it
Yeah,
a few times. When you do surgery, you do the best you can with the skills you have. And I bet you really enjoy when patients say, Dr. Walter, whatever you feel is best. Do you love that
yeah.
when patients say that
Yeah,
and they trust you?
I really appreciate that vote of confidence in my clinical decision making and just also me as a human being that I know I have a good I think sense of when we've treaded over into where first do no harm, right? So I
Yes,
think
$100%.
I think I have a good compass when it comes to that my clients trust, and that
Right.
makes me feel good. I think that's definitely also something that's a little bit like jarring for when you're a new doctor is that you spend all this time always looking to the practitioner in the room for the answer, and all literally overnight you become that person. You know what I mean? It goes from
Yes.
you being able to confer with somebody else or to listen to what someone else is saying, and now all of a sudden all the eyes are on you in the room asking you to make decisions.
You
And I
have to
think
want that.
you know
Yeah.
it is it's a you do have to want that, but you also have to give yourself grace that like when I entered the field I was 26 and I had people much older than
Wow.
me looking to me to make decisions or to break hard news or to intervene in an emergency. And I think that imposter syndrome is something
Sure.
that everybody feels,
Yes.
but to give yourself a little grace that like there were days where I was like, I'm just 26 years old and I don't know what to do, you know what I mean?
Wow.
But like give yourself the grace that you do know what to do, lean on your training, go back to what but that it's also okay to feel like the pressure of that situation because we all are just people. And like
Yes.
I try to tell young doctors that are coming up, like every brain surgeon had to do brain surgery for the first time. once, you know.
Yep.
Not no one is born with these knowledge, this
The
information like
skill.
intrinsically bred into them. And so you do sometimes just have to take a little bit of a leap of faith and trust yourself and trust your training. And I like that feeling, but at the same time, again, I think like that imposter syndrome that a lot of people talk about, everyone goes through that, no
We
matter
certainly do.
how comfortable you are in that kind of
Yep.
a setting or in that kind of a role.
I think
Um,
it's natural because we take ourselves seriously, our roles in society, and we
yeah,
don't want to make mistakes, and we don't know it all.
right.
But sometimes you have to have faith, like you said, in your training, your ethics
Yep.
also, because
Yep.
again, as a pet owner, I don't know
Yeah.
if you did a good surgery, bad surgery, if you treated
Right.
my dog. I just have a feeling, and sometimes that's enough to get us past that imposter syndrome, and that
Yeah.
they're entrusting me with a loved one
Right.
and I'll do the
Absolutely.
best I can. So, did you work during high school in a veterinary environment or just when you were later in that gap year?
So I did, I worked with horses, at the
Okay.
time, which again, I always kind of think of as like my gateway into this whole thing. And I think that not so much like I really loved biology in high school.
Okay.
I loved that class. And I think science was a lot more interesting to me when it was in the context of like disease, pathology, that kind of thing. But I think outside of like my courses and stuff in high school, I was just like a big horse girl and I love being around horses.
Wow.
I love the animal, and so I started working, in again, like a hospital setting for horses.
That was in
Um,
high school.
yep.
Wow. Okay.
Just part
So
time.
you did that part-time
hmm
through college?
Toward the end of high school, and then yeah, I would come back and work,
Okay,
here
so
and
there was
there.
a consistency there that lasted more than 4 years.
Yeah,
A
and then
little bit
I
of high school.
once it was in I apologize, someone's
That's okay.
knocking at my door.
That's okay.
Once I was in Kira, once I was in college, I started to work at a small animal hospital, which I continued to work for, until veterinary school. Hey.
You want to introduce us to your roommate there?
Yeah, I have three dogs with me right now. The loud
Wow.
one is Kira, who I've had actually. I got her when I was in veterinary school.
Wow.
She moved back from California with me, and then this is the puppy who we just
Okay.
adopted recently. And then I have an 18-year-old Chihuahua sleeping over in the
Oh
corner.
my goodness, how
Yeah,
adorable.
yep, our whole
So
little tribe.
let's wrap this up by saying, okay, now you've had how many years postgraduate are you from veterinary school? About 6 years or so?
This I in May it will be my 5-year anniversary.
5 years.
Yep.
What advice would you give your high school self? Now you're 16, 14, 16 or so. What would you say to yourself, not knowing what direction you want to take?
Yeah, I mean, I think I would echo some of the advice that I did receive. And again, just staying open-minded about the whole field and just, my life at large, to be honest with you. Like, don't close any doors, be, really receptive, try things that you don't think you're interested in, because you never know, you may find that you actually do really love something
Yep.
that you never even considered. I think a big a big thing that I would also advise myself would be to maybe prioritize or not prioritize, but just put a little bit more time into like building my financial literacy. Because I think, as somebody who knew, okay, I'm going to be in school for the next, what felt like the rest of my life at 18. I don't have any money. I don't need to worry about it right now. I'll worry about that later. I felt like when I graduated, I was kind of behind because it was just not something I ever spent any time
Sure.
considering. And especially if you're somebody who knows, like, okay, I'm going to be dedicating a lot of time and finances to the pursuing of this career, starting out earlier and just getting comfortable, or at least, again, like somewhat familiar with these conversations about finances is going to be a big leg up to you. Or even just building a relationship with a professional. I have a student loan advisor and a financial advisor, and I don't really know what I would have done without them, coming out of school with all the student loan burden and stuff like that. And so I think not just totally ignoring that element of
Yes.
this until the last
Yes.
minute. I would probably say, start building that financial literacy earlier, would
Okay.
probably be a good bit of advice. And also just to like stick with it, girl. Like I had it going on. I knew what I was doing. And I would just, kind of encourage myself to, stick with my gut, because any decision that I made ended up being the right one.
Right.
Even if it wasn't what I had originally thought it was going to be.
And I'm sure you even think of that in surgery sometimes, is stick
Yeah.
with it. Let's get
Yeah.
through this. You can do this, because
Have
sometimes the
faith in
best laid
yourself.
plans,
Yeah.
right? That advice does you well even today.
Yeah, and like you said, best laid plans, sometimes a decision you make or you don't make completely
Yes.
changes things. And not to say that like what would have been before would have been bad, but
Yeah.
this is also good too.
Yeah.
And again, just to kind of, again, have faith in yourself, have faith in your convictions, and keep an open mind.
And keep going.
Yep, and keep going. Yeah, forward.
Yes. Rachel, thanks so much. I know this was an inconvenience for you, and I really
Aw.
appreciate it. Having been your optometrist since you were literally, I think it's sixth grade, I've
Yeah.
witnessed every stage of your life. I couldn't be prouder of you.
Oh,
Prouder of
thank you
you.
so
Number
much.
two, I know it's just beginning. Like you're thinking, oh,
Yeah.
all right, but those loans will get paid off. And
Yeah.
then all of a sudden, your confidence within yourself will grow. And, really, the future is your oyster, like they say. It really
Yeah.
is. So I look
Yeah.
forward to hearing about your next big achievement. There are
Oh.
many to come.
Thank you so much. And thank you for having me. This was so fun.
Okay, thank you.
Have a
Okay,
good one.
everyone, until next time, enjoy your day. Bye-bye. Welcome to Patient to Professional. I'm Dr. Nick Despotidis, and in this podcast, I sit down with my current and former patients, people I've known since childhood, to talk about their careers, the challenges they faced, and the choices that shape their lives. I've always been intrigued by patients sharing their story with me in the exam room, and I came up with the idea of this podcast to share these gems with my current patients, because I feel strongly parents and students can benefit from their peers' experience.